Welcome back to the program. Now, you're quite aware, I don't need to remind anyone, we are into the Carnival season. This is going to be the second major weekend for Carnival 2025, and in that regard, people are getting themselves ready or asking the question, where could I get my flu shot? Because that has become a regular part of the Carnival experience. You take your flu shot to give yourself that layer of protection going into the very hectic season. To give us some details concerning that development, we welcome Chief Medical Officer Dr. Roshan Parasram. He joins me on the Zoom line, and Grace Sookchand, Manager of Expanded Program on Immunization under the umbrella of the Ministry of Health. Good morning. Welcome.
Hi, good morning. Good morning to the viewing public as well.
That's right. Grace, good morning to you.
Good morning. It's a pleasure to be here this morning.
Well, I recognize you're rolling out everything tomorrow. Tomorrow is a big rollout across the entire length and breadth of Trinidad and Tobago, and I would imagine this is something. I know I took part in this for many years. I'm happy it's back. I used to go to the health center there in St. James to get what we call the Carnival flu shot, but I recognize it's a massive rollout. Give me some more details.
Right.
So basically, as before the Sookchand comes in, as you know, just to remind the public, the influenza season in the northern hemisphere actually runs from October to May of every year. So we're still well within the influenza season. Of course, as you have given in the preamble, we're coming up to a season where you expect mass gatherings occurring, which they are occurring already. And then, of course, coming out of Carnival. So we're asking persons to avail themselves or really encouraging persons, especially those in particular at-risk groups, to have your influenza vaccine if you have not done so for this particular season. So those at-risk groups, just to reiterate, are children under the age of 5, those over 65 years of age, those with chronic illnesses, for example, diabetes and chronic asthma, pregnant patients, and the immunocompromised. As you had up in your flyer there, we are beginning the mass vaccination sites to give persons an additional avenue where you can actually seek your influenza vaccines outside of the normal health centers. So just to say, the vaccines are also available at all health centers nationwide, but the special sites that we're putting up from tomorrow, which is January 11th to January 19th in the first instance, would be at the North Central Regional Health Authority. We're looking at the Diwali Nagar site from 12 noon to 6 p.m. daily. At the Northwest, we're looking at the Paddock area, Queens Park, Savannah, 8 a.m. to 4 p.m. daily. At the Southwest Regional Health Authority, we're looking at the Gulf City Mall location, 12 noon to 6 p.m. And of course, at Eastern, we continue to do it at all the health centers there, including the Sandy Grande Enhanced Health Center. And we're looking, if you see the flyer will also speak to men. Prostate screening will also be available at these sites during those times.
That's right.
So, Mr. Chan, if you want to add anything on those mass vac sites.
So not so much, you have basically covered it, but we just want to advise the population that even though these mass sites are open, the vaccines are available at all health centers Monday to Friday between the hours of 8 to 4.
Is there the capacity this time around for the prostate testing? I know the last time you all did that mass testing, people really, they came out in their numbers. It was overwhelming. You all were able to increase that capacity for the prostate testing part of this rollout?
So yes, we will really welcome the large turnout from the men for prostate screening across all the RHAs last time. And in terms of the RHAs, their readiness and preparedness, having seen the massive turnout in the past, we have put things in place to ensure that there's a freer flow in terms of the lines up.
And is it the same kind of testing, Dr. Parasram, the same kind of blood test you all did last time?
Similar types of testing. Usually is a point of care testing device, and then of course that is, if you are positive, of course we do confirmatory tests as the need arises.
Understood. Let me ask, and probably Ms. Sookchand or Dr. Parasram could weigh in. For those who want to take the vaccine, but they are concerned about probably side effects, are there any proven side effects? If so, you could identify?
Right.
Yeah, so the vaccine, as you know, has, Grace, you could go ahead. You begin and I'll come out. Go ahead.
All right. So with any vaccines, persons normally complained of a little irritation at the vaccination site, which is normal. With the influenza vaccines, persons may complain of a slight sore throat, a little rise in temperature, but these are mild effects and they normally clear up within a day or two. Dr.
Parasram, you want to weigh in?
Yeah, so as we said, these vaccines have been around for quite a long time. They're not a new vaccine. They're a quadrivalent vaccine, meaning they have 4 components, so there are two to cover type A and 2 to cover type B. And really the symptoms usually are mild. Most people have no effects at all post-vaccination. And just to remind, this is a seasonal vaccine. It's not an annual vaccine. And the difference being, you have to have it every flu season. So as I described, the flu season is from October to May of a given year. So it overlaps in years. So if you had it, let us say, in April of this year, when a new season begins in October, we don't expect to say that we had it in 2025 already. We're not going to have it until 26. We want you to have it every flu season. So again, when the new strain comes out in 2025 October, we expect that you have it again to cover for, because what is being done is the production takes into consideration mutations from the previous season. So you get protection for the season and not the year.
Yeah, I mean, I'm pretty involved in the carnival, and it's something I remember deceased Blacks, actually, may he rest in peace. Blacks was the one who, years ago, in a conversation with him, recommended that, hey, Jay, you should go take, they call it the carnival vaccine, just to give yourself that layer of protection going into the season. And I must say, I've done well with it so far. I want to find out, though, when we look at the international developments, we head back to China. We saw recently flu-like symptoms, people going into their medical institutions. Obviously, we heard that it's no major concern at this point in time, but do you all keep your eyes on all international developments? Because, the world is that global village again. We up and about and people are moving and grooving. What's the latest coming out of that development?
So as you said, I think yesterday in the Express, there was a bit of article covered based on our press release that we sent out a couple of days ago, indicating because it's a territory outside of Trinidad, of course, we have to liaise with the authorities that monitor those events outside. So WHO will be the primary source for information, as well as PAHO, which is the region of the Americas division of WHO. And we have been in continuous contact with them, the PWR and myself, which is the PAHO WHO rep for Trinidad and Tobago. And they have issued a statement, as you all know, indicating, and I could read off the PAHO's report, which basically said, according to the surveillance data from China CDC, for the week 23rd to 29th of December 2024, there continues to be a rise of seasonal influenza, including HMPV, which is the human metapneumovirus, as well as rhinovirus and adenovirus. And it's all mixed in. HMPV is really a virus that has been around for more than 2 decades. It's not a new virus at all to the world. So it is around. And it forms part of the normal viral landscape of any country as you go through any season.
And that's why I'm so happy we have these, and that's why I'm so happy, Dr. Parasram, we get to have these conversations, because, we want to dispel misinformation. People sometimes are alarmists, and you want to evoke this kind of emotion from people. So I'm happy that you were able to give us some details in that regard. Could you answer, as it pertains to Trinidad and Tobago, though, any increase at all with flu-like symptoms? What's the numbers showing right now? Dr. Parasram, Grace could also weigh in.
Sure. So for last year, I'd asked my unit to give me some statistics for 2023 and 2024. So for 2023, we had confirmed 262 cases and 6 deaths. For 2024, we actually had 118. So it's less than the confirmed cases are less than for 2023. And that's particularly what you saw in the release from PAHO stating to China as well. There was a decrease from 23 to 24. So basically, the height of it was really October, November, I would say, into the early part of December. But as you see, people beginning to move and travel again, coming into the new season, you find that, and especially with schools reopening, generally when schools reopen, you tend to get for 4 to 6 weeks post-school opening an increase in viral illnesses generally, not only respiratory illnesses, and that's because of course, children mixing and mingling and taking that infection back home, and then the classroom itself with so many kids in close proximity is an avenue where the viruses can spread rapidly. So we want to reiterate the basics of respiratory etiquette, which is, of course, covering your cough when you sneeze, watching your distance, wearing a mask where appropriate, as well as, of course, if you're sick, and the most important part is if you're sick, stay at home for the kids and for persons working. And if you're going to have to go to a mass event and you're ill, please reconsider. And if you do go, keep your distance and wear a mask at best.
Yeah. Thanks a lot there, Dr. Parasram. Grace, Sookchand, again, before we wrap things up, give us the rollout. I know tomorrow you all are hitting the road, as we say, in a major way. Give me some more details one more time.
So just to remind the population, the Ministry of Health, via collaboration with the Regional Health Authority, will launch the mass vaccination sites that will be administering the vaccines starting tomorrow's January 11th until January 19th at the following locations: the Diwali Nagar site between 12 p.m. to 6 p.m., Paddock at Queen's Park Savannah, 8 a.m. to 4 p.m., Gulf City Mall, 12 p.m. to 6 p.m., and all health centers under the Eastern Regional Health Authority. And let us remind the population that all health centers throughout Trinidad and Tobago will also be offering these vaccines. So basically, our key message is that the influenza vaccines is safe and effective way to protect yourself and your family during the flu seasons. And therefore, we ask persons to stay protected, to get vaccinated.
Ms. Sookchand, sincere thanks. Dr. Parasram, sincere thanks. We have a couple seconds. Any quick closing remarks?
No, thanks for having us. And of course, as we unfold, we will keep the population abreast of any developments that occur.
Indeed, and thank you so much, Dr. Parasram and Ms. Sookchand, for the great work. Thank you, and all the best for 2025, guys.
Thank you so much. Have a good day.
That's right. I think I'd enter the paddock tomorrow to get my job. I don't play with that, folks. Again, Blacks, thank you for that great advice. May Blacks rest in peace, man. What a great friend and great artist there. Let's get ready for another impactful conversation as we work our way to the 7 o'clock hour. Today, my friends, it's a special day. It is World Hindi Day, and Dr. Bimal joins me, founder of Caribbean Hindustani. World Hindi Day. Important conversation. Up next, I look forward.